Back on the 22nd of April, Council decided to entrench vehicle usage around Concord Hospital by extending the time that Lovedale Place would be available for parking of private vehicles. So what I did on Saturday, 24th, is I went for a very detailed ride around the hospital campus, I guess you'd call it that, and then followed it up with another ride through a bit of it on Monday, just to see what the available parking was like. Now here we are going into Lovedale Place, and you can see it's this nice little, well, was once a green area, it's not so green anymore, and there were a few cars parked in here on the Saturday, but not many. And there is a horrible little path going up the side here where once you're parked you can get up to the hospital. So we've got council banging on about reducing greenhouse gases and tackling climate change and wanting to encourage active transport, and then turning around and encouraging private vehicle use. So seems a little bit confusing to me. But as I was riding around, and it took me about 25 minutes to do all of this, I was thinking, well, how many spaces are there in total in this entire hospital campus, not just in this car park here? What are the total staff numbers across the entire campus? You know, not just in the hospital, but including the research clinics and all the other associated entities which have office space here. What's the utilisation across all the parking on different days and at different times of the day? Is parking really a major problem at shift changeover times and not perhaps at other times? What's the bike parking like? Well, I can answer that. It looks pretty awful to me. What are the bike routes in and out of the place like if you wanted to commute? Well, that's going to be a separate video, and I can say I don't think they're very good. And what's the cost of parking? Well, here's the cost of parking. I don't know if Lovedale Place is free, but certainly, you know, it's $20 a day if you want to park in here. So like shift changeover, I think, is definitely an issue, because at shift changeover time, you've got the preceding shift still on duty because they need to do a handover to the incoming shift to explain what happened with the patients during that shift. So you're going to essentially have double up of parking until the previous shift pack up and go home. Now, I'd never been into this area where all these research clinics are and other things. And you can see there's a lot of parking through here. You have to go through a boom gate, so obviously you need a staff card or something to get in here. And what I didn't have a close look at is whether some of these parking lots are allocated to particular clinics or research entities or whatever. Or is it a free-for-all that once you've got access you can park pretty much wherever you like in this area? I have no idea. But you could see that, you know, if a certain clinic has 50 places allocated to it and they're only using 20 of them at any given time, you could see how you could end up with this big mismatch between supply and demand and it not being well allocated across the whole precinct. I guess that's something council needs to ask about. There's our second bike rack. I wouldn't park there. I mean, it's, you know, just not safe, obviously, if people are driving over it, and certainly not secure. And as I rode around all these places, I was having a look at every single building to see if I could find other bike parking of some sort. And the answer was, in this entire area, I couldn't find a single bike rack anywhere. So not particularly encouraging for active transport. I mean, if I worked here, I guess I'd see if I could just take my bike inside and park it next to my desk or something like that. Then we have this nice big gravel car park. Who knows what this is for, but it exists. And who uses it? Well, I have no clue. But you can see, I mean, there's just parking everywhere. Now what we're doing now is we're heading up towards the area where the new wing of Concord Hospital is being constructed. And one thing which I did wonder about is there's this great long list of subcontractors who are working on this site. You know, plumbers, concreters, tilers, glaziers, carpenters, air conditioning people, electrical people, people that do the specialised gas fitting for the oxygen supply, all that kind of stuff. Where do they park when they are here Monday to Friday working on that wing? Because obviously you've got lots of tradies turning up in utes with their tools and their materials and all the rest of it. So is Lovedale Place really required for hospital staff, you know, like doctors and nurses and admin staff and cleaners and the caterers and, you know, all those people that actually do stuff to keep you healthy? Or is the parking required by the subcontractors who are working on that wing? And with that influx of tradies coming in, the nurses, etc., are complaining they can't find a place to park. Who knows? But I think it's worthwhile council asking that question, because why should the council be providing free parking to tradies working on a construction site? I mean, I'd be going to the contractor or to New South Wales Health and say, hey, look, if you haven't thought about allocating parking or supplying parking for these tradies, you need to pay for it, because that's all part of the project costs. This is the kind of pick up and drop off area at the hospital, and there's another bike rack. So that's 3 bike racks. Not so good so far. There's a little bit of on-street parking here, but I think it's pretty chaotic, and residents probably get driven mad by people parking there. I did duck into these 2 side streets here, which lead off to the hospital. This one was a bust because there was a gate there, couldn't get through. I have no idea what's on the other side of it, how much parking is available there. But this next one, again, there's a boom gate, so you obviously have to work here to be able to park here. And lots of other funny little buildings tucked away down here. Again, don't ask me, what happens in these buildings. That was a gated parking area, so obviously you could only park in there if you worked for that particular mob, which looked like it was, I don't know, Ambulance New South Wales or something. So again, you have to ask the question of, well, is there actually a shortage of parking overall, or is this are these spaces being underused, but I don't know. I guess it comes back to this question: if you've got 50 different entities here that have parking allocated to them, and they're all jealously guarding their little patch of turf, and a lot of it is being underutilised, but you've got a couple of areas where there's a massive undersupply parking compared to demand, well, that mismatch is going to drive, council to providing free parking. A little bit hard to explain. Anyway, here we are on Monday. Different story in this car park. It's kind of now 98% full. There's people double parking. There's people parking on the grass. Although, funnily enough, when we get right up to the northern end, which is the furthest distance from, I guess, where you'd want to be, there was actually quite a bit of parking. So, maybe people are lazy and they just don't want to drive down here and look for a parking spot. Has council really been justified in providing, this area of Lovedale Place as free parking? Is it really necessary? Have they really done the detailed nitty-gritty work to find out whether it's really required? Or I guess, have they really gone and asked New South Wales Health? Have they gone and done the nitty-gritty? Have they gone through all the divisions and units and clinics, etc., in this campus and said, hey, have you got free park? Have you got available parking? Are you using it properly? Are we really using the full pool of parking properly? Are we encouraging people to walk or ride here from the train stations or whatever? So who knows? Anyway, there's the video. Make up your own mind.